In daily life, many people often experience arm numbness while sleeping. This phenomenon is especially common in those who tend to sleep on their side, lie on their arm, or hold a pillow in a position that causes pressure on the arm. When the body maintains an incorrect posture for a long period of time, blood circulation to the arm becomes restricted, leading to tingling, heaviness, or temporary difficulty moving. Normally, this is only a physiological reaction and will quickly diminish when you adjust your sleeping position, allowing blood flow to return to normal. However, if you have tried correcting your sleeping posture, but the numbness still appears frequently or lasts for a long time, it may be a warning sign of a potential health issue. Persistent numbness is no longer just a matter of posture, but may relate to abnormalities in the nervous system, blood vessels, or other underlying conditions. Ignoring these symptoms may cause the problem to worsen, affecting daily activities and sleep quality. Thank you for listening. Therefore, when numbness does not improve despite changing sleep habits, you should pay attention to accompanying symptoms and consider early medical consultation. Only by identifying the exact cause can treatment be effective, helping to reduce complications and improve long-term health. Numbness in the hands and feet during sleep does not only come from posture, but can sometimes be a sign of underlying medical conditions. One common cause is peripheral neuropathy. When the peripheral nerves are damaged, patients frequently feel numbness, weakness, or pain in their limbs. This condition is especially common in women over 40. Symptoms may gradually spread up the arms or down the legs, making movement difficult and even leading to muscle weakness, muscle atrophy, or partial loss of sensation. Another cause is diabetes. When blood sugar remains elevated for a long time, nerves and blood vessels lose function, resulting in numbness, tingling, or crawling sensations in the limbs. People with diabetes may also experience itching, excessive night sweating, frequent urination, and abnormal eating habits. If numbness stems from diabetes, blood sugar control becomes essential to improving symptoms. In addition, cerebral arteriosclerosis can also cause hand numbness, especially in the morning upon waking. As blood vessels narrow and lose elasticity, the amount of blood flowing to the brain decreases, causing the central nervous system to function ineffectively. Patients may experience cold extremities, dizziness, headaches, weakness, or fatigue. More dangerous is a stroke. Before an acute stroke occurs, cerebral blood vessels are often blocked or severely weakened. Numbness in the limbs is one of the early warning signs. If cerebral ischemia progresses, patients may suffer nausea, vomiting, facial drooping, paralysis, or visual disturbances. Besides these conditions, hand numbness during sleep is also common in those with cervical spondylosis. Therefore, monitoring symptoms and seeking timely medical care are essential to identify the correct cause and treat effectively. Along with serious conditions such as peripheral neuropathy, diabetes, cerebral arteriosclerosis, or stroke, hand numbness during sleep can also result from cervical spondylosis, a very common issue in adults, especially those who work extensively with computers, keep their head bent for long periods, or do heavy physical labor. When the cervical vertebrae deteriorate, bone spurs or herniated discs may compress nerves and blood vessels in the neck, shoulder, arm region. This compression disrupts nerve signals traveling down the arm, leading to tingling, pins and needles sensations, or pain radiating from the neck to the shoulder and arm. A key feature of numbness caused by cervical spondylosis is that it often worsens when lying in one position for a long time, especially with a high pillow or a bent neck. Many people wake up with a stiff neck, difficulty turning their head, and numbness in the hands or arms. Unlike numbness caused by simple circulation issues, this type tends to last longer and recur often. Because there are so many possible causes of hand numbness while sleeping, self-diagnosis may lead to carelessness or unnecessary worry. It is important to observe accompanying signs such as headaches, dizziness, weakness, motor disturbances, cold extremities, unusual sweating, or changes in skin sensation. These symptoms help distinguish between simple numbness and numbness caused by dangerous conditions. When numbness persists, recurs frequently, or worsens over time, the patient should seek early medical care to check nerves, blood vessels, and the spine. Treating the correct cause not only improves numbness, but also prevents serious complications that may affect long-term health. Being proactive with health care and early detection is always key to protecting the body from hidden issues that we may not recognize on our own. When hand numbness occurs frequently, especially at night or upon waking, the most important thing is not to take it lightly, but carefully observe accompanying symptoms. Each cause of numbness has its own characteristics, so identifying the right symptoms is crucial to determining whether the issue comes merely from improper sleeping posture or is linked to an underlying health condition. Assuming that numbness is always harmless may cause patients to miss the golden opportunity for early treatment, especially in conditions related to nerves, blood vessels, or the spine. In reality, many cases of nighttime hand numbness are early signs of serious disorders such as poor cerebral circulation, nerve compression, or structural damage in the neck, shoulder, arm region. Small symptoms like tingling at the fingertips, pins and needles sensations, cold arms, or weakness may actually be warnings that the body is in trouble. If numbness is accompanied by unusual symptoms such as headaches, dizziness, difficulty moving, sensory disturbances, or unexplained night sweating, it is likely no longer a simple issue. Therefore, instead of guessing or enduring the discomfort, patients should seek medical evaluation as soon as possible. Doctors will use specialized methods to determine the exact source of the numbness and provide suitable treatment. Treating the root cause is the only reliable way to achieve lasting improvement and prevent the condition from progressing into more serious health problems. Listening to your body and taking proactive care is always the key to protecting yourself from hidden abnormalities that we may not immediately recognize.